Passive accessories for the lumbar spine. We're going to be performing our PACVP, posterior to anterior central vertebral pressure. To do this, I'm going to show you two different ways in which we can do it. Traditionally, we tends to have been performed with our thumbs placed together, and as I was taught, CMCs together to try to protect your carpometacarpal or your metacarpophalangeal or even your interphalangeal joint from overextending and then applying too much pressure through the joints. However, over my years of practice, I've kind of developed away from that just because whatever I did, it didn't seem to offset those pressures, and I really don't want arthritic hands as I progress forwards. But of course, they are still valid techniques, and you can still do those if you so choose. But I'll show you the ways that I do it. This is just my way, so you take that as you see fit. For PACVP centrals then, so if we're going to find a particular level, let's just say we're going to find, say, L2, then when we're performing our technique, certainly in this position here, I've got the pillow underneath to try and neutralise the spine. We want the lumbar spine neutral, not in extension, not in flexion, because then the vertebrae are easier to move. Having said that, there are situations where you do want them at those extremes of range, only if we're trying to influence that specific motion. So that just gets a bit more complex in terms of our manual therapy. For this more simplistic though, have them in a nice neutral position, because then we're relatively loose pack and the vertebra will move a little bit easier. So the way we can perform this, one is with a pisiform grip, so you locate the spinous process that you want. Pisiform in that hand there goes over the nail of that thumb, so I can feel essentially through the thumb. Take the thumb away and then check that I can feel it. Now that requires a certain dexterity of your pisiform, which is not the most dexterous part of your hand, so I will show you the other alternative. And then we're going to lock my left pisiform into my right scaphoid, in towards the anatomical snuff box. Then we lock our hands across one another and squeeze the hands together. Not everyone can get their hands into this position, so if you can't, you can always just place one hand over the other in this way. I quite like this, it makes it feel like it's quite strong. Your shoulders then need to be over the top. Drop your shoulders down, so you don't want to see any mobilisations with them up. And then from there you can apply the pressure down from your arms. So you're kind of pushing from triceps and also from your lats. Okay, so as we perform the technique, we're going to go through the resistance-free range, back off slightly, into resistance, back off slightly, and then feel for the end of range with our test range. Are you ready? Okay, so if you feel any pain, I want you to wiggle your left hand. Okay? Okay, here we go. So applying a little bit of pressure, back off slightly, push into resistance. We can go with their breathing as well, back off slightly, then go for the end of range. Okay, so no pain was identified, which is fine. Obviously we wouldn't tend to be therefore treating this unless we felt it was particularly stiff. It's not in this case, but I am going to treat it anyway to show you for the camera. So as we perform our mobilisation, let's just start with our grade 1. So I'm going to take up the slack, back off, and then perform my technique. Almost, you can't really see it, can you, from the camera? You can almost just see a very slight, almost twitching. For a grade 2, we just go larger. We emphasise coming off the back. So you should be able to see a bit more motion there. Grade 3, you might want to zoom in if you're looking at these online on YouTube. For grade 3, we're going to apply greater pressure in. And there is our grade 3. Much more discernible, and you can see their body giving into that motion. And then grade 4, towards the end of range, very small motion, but do nice and fluidic movements, no jerking. An alternative way to perform it, as I said I would show, is to place your thumb on as we were doing, and then you go to grip in here, and then we do this, but leave the thumb there. I don't like that because it starts to, your thumb can essentially get squashed and it can be a little bit sore. It's really nice for grade 1 and 2, so you can place a hand over the top here. So this could be my grade 1, and this could be my grade 2. You can do 3 and 4, but obviously your thumb is in the way and that's going to put quite a bit of pressure through there, so that can be a little bit unpleasant, but that's your call. For a PA-UVP, we're going to do exactly the same thing, we're just coming off to the side. So now we're on to the transverse processes. In general, approximately, they are in line with the spinous process, but I emphasise it's approximate. Everyone's anatomy is different, but they are roughly in line. So we can find our region that we're looking for. Let's go slightly lower. And then we come off to the side. Now, lots of people say, oh, it's one thumb, it's one finger, it's a little finger, it's big finger, it's whatever. That all depends upon the size of your hands, but it also depends upon the patient. If you follow the line really of their erectors on their back, that tends to give you a really nice guide. The kind of the high point is approximately where the transverse process will be. So we can do the same thing where we can feel for where that location should be. I challenge you on someone with quite good musculature, such as our patient here, to be able to feel for this transverse process. Certainly I can't feel it. You can feel that there is something firm underneath, so you know that there is definitely bone under there, but you can't actually feel the tips of it. But we do know anatomically it should be there, and we're in line with that level. So therefore we can come in here and then perform exactly the same as we did for the PA-CVP, or, as we said before, keep the thumb on and then apply the pressure straight down. Okay. For our transverse vertebral pressure, we're going across the body. Because we're going across, not down, down, it's bed down. Across, it's bed up. So in this position, bed up nice and high. And then the level that we're going to work on, we would need to find. I'm going to go here, it's around about L3. And that's the spinous process. And this thumb, which is going to be my tool, I'm going to feel the edge of the spinous process and just come off. I don't want any tension in their skin, so don't drag the skin over. And come off the edge. And then I have to work my way in and down to the side of that spinous process. Don't just dig your thumb in. I need to push into there, and then using a key grip on this side, as I used to call it a widgie grip, until the student pointed out that's a key grip, so thank you for that, that's one of my master students. We're going to place the key grip onto that thumb. So this is the tool, this is the force. So it goes in to there, and then we'll apply the pressure through. Now when we're testing, you won't feel very much motion, remember, 1 degree per level, so it's a tiny, tiny amount. So I'm bending my fingers out the way so that hopefully the camera can pick this up. But in general, I'd actually have my fingers splayed out. So we push down, and then we push across. Okay, so we're pushing across the body. So I can test the range in, and in. I'm having to push down to be able to push across. Any pain, obviously, we can pick those up. And then when we perform the mobilisation, you want a counter rotation of the pelvis. So if we have a watch, so for instance with a grade 1, you don't get very much counter rotation. Grade 2, very little as well. Grade 3 is where we really start to get the counter rotation. So we're into resistance and we're applying quite a pressure. And then grade 4 obviously smaller and towards the end of range. So that's our kind of applying hands-on techniques, PA-CVP, PA-UVP and TVP or transverse vertebral pressure.